He exercised, he ate healthy and clean. His LDL cholesterol was normal, and yet he still had a heart attack. This story is more common than you think.
I have taken care of patients who did everything right and with perfect LDL cholesterol and still ended up in the ER with chest pain. And I have also seen people with high LDL cholesterol live for decades without heart disease. So, what is really going on? Here is the real question we should all be asking. Why doesn't LDL cholesterol alone predict heart disease? Today, I will show you why LDL cholesterol alone doesn't predict heart disease, what doctors don't explain about cholesterol panels, and the hidden factors that actually decide whether plaque forms in your arteries.
For decades, we were told a simple story. LDL is bad cholesterol. High LDL causes plaque, and plaque causes heart attacks. Simple stories feel safe, right? But the human body is rarely simple. Now, if you've ever been told your cholesterol looks fine, or you need a statin medication based only on LDL cholesterol, this video could change how you think about your heart risk forever. Stay with me because the most dangerous cholesterol problem is the one your lab report doesn't flag.
You see, LDL cholesterol matters, but it's only part of the story. Here is what often gets missed. An LDL number by itself doesn't tell you how dangerous that cholesterol really is. In fact, LDL doesn't attack healthy arteries on its own. And most importantly, LDL isn't the decision maker or the one calling the shots. Think of LDL like delivery trucks on a highway. The trucks aren't dangerous unless the road is damaged. Quite frankly, LDL is like saying there is smoke, but it doesn't tell you whether there is a fire, where it is, or how fast it's spreading. This is the part most people miss. Heart disease isn't caused by cholesterol alone. It's driven by inflammation, metabolic dysfunction, and damage to the blood vessels.
Okay, a standard cholesterol test tells us how much LDL cholesterol is present, but it doesn't tell us what kind of LDL is circulating and how harmful those particles are.
For example, two people can have the same LDL number and completely different heart attack risk. Why? Because LDL cholesterol isn't one thing. It comes in different particle sizes and forms. Then there is oxidized LDL, a form of cholesterol that fuels inflammation, damages the endothelial lining of blood vessels, and worsens insulin resistance. Simply put, LDL doesn't cause plaque on its own. Damaged arteries invite plaque to form.
Here is an important piece of information that is rarely discussed in the clinical setting. Some LDL particles are large and fluffy, others are small, dense, and aggressive. Now, the small, dense LDL particles behave very differently inside your arteries.
These small, dense LDL particles are far more dangerous. They slip easily into damaged artery walls. They oxidize faster, and they trigger stronger immune reactions. And large LDL particles, they are less likely to penetrate the vessel wall and less likely to spark inflammation and immune response. So, a standard LDL number that is routinely obtained doesn't tell you which type you have. This explains something that has confused doctors and patients for years. Now, LDL cholesterol only becomes dangerous after artery wall is injured. But what conditions accelerate vessel wall damage? Chronic inflammation, high blood sugar, insulin resistance, smoking, poor sleep, and chronic stress. These damage the blood vessel lining, also known as the endothelium. Let's discuss what happens next.
Once the artery wall is damaged, LDL particles then slip into that damaged wall, get oxidized, and trigger an immune response. Inflammation builds and blood vessel plaque forms. That is the moment heart disease truly begins. This is a critical point to understand. The immune response, not LDL itself, that builds plaque inside damaged blood vessels. This is why people can have normal LDL yet develop heart disease when inflammation or insulin resistance is present.
So where do statins fit into this picture? These medications are known for lowering LDL cholesterol, but their role in heart protection is more complex and more interesting than most people realize. This is where statins often confuse people. They don't just lower LDL, they reduce inflammation, stabilize plaque, and improve blood vessel function. That's why some people benefit from statins even when their LDL wasn't very high. But lowering LDL without addressing inflammation, insulin resistance, and lifestyle is like repainting a house with a cracked foundation. Clearly, lowering LDL alone without fixing metabolic health is not complete prevention.
If you truly want to assess heart risk, LDL is just the beginning. Better predictors include assessing LDL particle size, high sensitivity, C-reactive protein, HSCRP, level for inflammation status, triglyceride to HDL ratio, fasting insulin, A1C trends, coronary calcium score, and blood pressure variability. This assessment is important because heart disease is metabolic long before it is structural. So here's another question most people never ask. Why aren't routine lab tests good enough? Normal lab ranges reflect the average population, and the average population is metabolically unhealthy.
I have seen patients told that everything looks fine. Normal LDL, normal total cholesterol, only to discover silent plaque on CT scans years later. If there's one thing to take away from this video, it's this. A normal LDL does not guarantee healthy arteries, and normal lab results don't mean you are protected. So, what should you actually focus on to protect your heart? Real prevention isn't about chasing a single number. It's about reducing inflammation, improving insulin sensitivity, protecting the blood vessel lining, building metabolic resilience, which include improving sleep, stress physiology, strength training, and aerobic fitness. Cholesterol is a messenger, not the mastermind.
Friends, LDL cholesterol alone doesn't predict heart disease. Context does.
If this changed how you think about cholesterol, like the video, share it with someone who's been told your labs are fine, and subscribe for evidence-based physiology-first medicine. Your heart deserves more than a single number. See you in the next video.